Welcome back. October is Breast Cancer Awareness Month, and there's a new resource to help women better understand their personal risk of getting breast cancer. To tell us more is Dr. Stitt. Dr. Stitt, thanks so much for being here today. We appreciate your time. I want to start with first the challenges. Why has it been so difficult, and what do individuals and women face when trying to understand and assess their personal risk?
Well, good morning, and thank you so much for having me. I appreciate the opportunity to talk about such a really important topic. The biggest challenge we have is lack of healthcare equity. What we have found is that, most of the genetic databases that were created were based on women of European ancestry. Therefore, a Black woman, a Hispanic woman, an Asian woman with a high risk of breast cancer based on their family history may not get the same exact accurate risk assessment as a person who had a European heritage. So we want to make sure that each patient has fair and equal access to their appropriate health care so that the correct and healthcare management can be attained.
What is being done to make sure that that fair treatment is achieved and to help people more understand their risk?
Yes, as we know, we know that the risk of breast cancer for the general population is 1 in 8. So that's why we have, October, Breast Cancer Awareness Month. But what a lot of people may not know is that Black women are twice as likely to die from breast cancer than white women. Hispanic women who are diagnosed with breast cancer have a 20% higher chance of dying of the disease. So I'm in partnership here with Myriad Genetics, who developed this new tool. It's called RiskScore. What RiskScore has done is it has obtained genetic information and created a new genetic database of women who are of non-European origin, over tens of thousands of these women who also have a family history of breast cancer. With this new genetic database, we're able to do a better job of stratifying and getting a more fine-tuned or accurate assessment for women of all ethnicities.
How is this new tool different from hereditary testing?
Yes, the RiskScore process actually incorporates what most people are familiar with. But with the genetic testing, the hereditary cancer genetic testing that most women are familiar with, really looks at the most virulent, or the ones that are the most likely to cause breast cancer. The most commonly known are the BRCA1, BRCA2 mutations that were made very popular by Angelina Jolie about a decade ago. But what we want to do is not only look at those type of mutations that are going to give the highest risk of breast cancer, we also want to look at those patients who may not necessarily fall into that category. Only 5 to 10% of women actually have a known genetic mutation. 90 to 95% of ladies are just out there not really knowing, and sometimes get lulled into a false sense of security if they test negative for a known genetic mutation. They might think they're like everybody else, and that's not quite accurate. There are lots of genetic factors, personal factors, many other factors that play a part, and that's what RiskScore is all about. RiskScore has taken all of these different factors along with the ancestry-specific information that makes a person themselves and really gives a more fine-tuned and a more accurate assessment of breast cancer risk.
And Dr. Stitt, how does RiskScore, this new assessment tool, affect your day-to-day practice and your interaction with patients, especially those who are particularly concerned? They may have a family history or other reasons to have a higher level of concern about this.
Well, I'll tell you that this actually impacts my day-to-day, literally every day. There are patients, in fact, I have one patient in particular that doesn't even know this yet. I'm really excited because you guys are going to hear the information before my patient does. But I have a young lady who I've been following since 2018. We actually tested her with the traditional genetic testing. However, because she's of Asian heritage, we weren't able to get a RiskScore for her because we didn't have the ancestry-specific RiskScore. With her original genetic testing, we found that she had about a 28% risk of developing lifetime breast cancer. Now, with the updated RiskScore process, we actually found out that her risk is now 11%. Why is this important? Because now she's actually a little bit closer to the general population. I have been managing her, or actually over managing her, because we were concerned about her risk. But I am so excited to give her the great news that she actually is not as high risk as we thought she might be, which is phenomenal because this young lady has young children. She has 3 that I've actually delivered. So I'm super excited to be able to give her the news that she's actually a little bit better than normal.
Oh, that is really big, life-changing news. So what are the next steps for women, and how can we get more information?
Absolutely. I would implore all of your listeners, your viewers, to please go to getmyrisk.com. Again, that is getmyrisk.com. It allows for you to take a quiz to determine whether you're at high risk for developing breast cancer. If you are, then you work with your healthcare provider to take a test that will make things much easier, and we would be able to get an appropriate assessment of what's going on for you, get you a specific risk.
Well, thank you so much, Dr. Stitt, for joining us today. This is really big, important news. Starting out, October is Breast Cancer Awareness Month. Get My Risk. You can find out more online. And once again, we're very thankful to Dr. Stitt for explaining this new assessment tool to us today. We'll be back with more here on Mountain Connections right after this.